Hey, good morning. You're in KSJE. Thanks for calling in this morning.
Good morning. This is Erin Philpott. How are you?
Good morning, Dr. Philpott. We are well. Happy New Year to you. We're glad to have you on the program.
Thanks. You too.
You've made Megan's day because she loves talking to you, as do I.
Yeah.
And then we're expecting, is Dr. Greenberg going to join us, do you think, this morning?
I believe so, yes.
Okay, I'll keep an eye on the phone. But since you were the first to call in, guess what? You're on the air first.
Okay.
So, welcome. And to start things off, Dr. Philpott, I'm glad that you're on the phone with us this morning because I did want to call out your very eloquent column that you wrote for the local newspaper, the Farmington Daily Times, about your experiences at the hospital these past few weeks and months. I just wanted to let you know publicly, I thought it was very well done, really heartfelt, and really expressed, I think, what a lot of your colleagues and peers are dealing with, not just in this state, but throughout the country. So thank you for sharing that with the audience.
Thanks so much, Scott. I appreciate that.
You're welcome. To get started, can we talk a little bit about how things are looking at the hospital? We just got through telling everyone about the cases, at least from the state's dashboard, seem to be lower, but I don't think they include any Omicron cases. Are we still seeing mostly Delta?
Yeah, great question. Overall, and I'll get to kind of the variants here in a second. Overall, our cases have come down. At least our hospitalized cases have come down significantly over the past probably 3 weeks or so. We're holding at a census in the range of 40s for COVID patients. But, we're picking up, as we usually do, between surges like this of non-COVID patients. That are just, it's not sure why this phenomenon occurs, but it does each time. So lots of really sick individuals with other illnesses beyond COVID. As far as the variants of concern, or Omicron, which is the one, of course, everyone has their eye on, to my knowledge, we don't have any definitive data that we have received from the Department of Health sort of outlining if we have Omicron cases in our county yet. There are, I think, 29 reported on the data dashboard on the Department of Health website. And Dr. Greenberg may have more updated information on this. I saw in some of the news media reports yesterday, it looked like officials, they had stated, were quoting about 50% of cases may be Omicron now. So in sum, we're uncertain how many of our current cases are Omicron, but it seems it hasn't, based on just the transmissibility and sort of how fast people are passing it around, we've probably not seen it yet in full swing, though it's most likely kind of in the early stages passing around our community. And that's purely my speculation based on the information I know so far.
Understood. But you're telling us the case numbers so far are at least lower at the hospital maybe than they were a month ago, which sounds like good news.
Yes.
Okay.
Absolutely.
Very good. Thank you very much, Dr. Philpott. Let me let me hit your button here an extra time so we can also bring in Dr. Greenberg, I believe, on the phone with us this morning, who's also joining us this morning. Dr. Greenberg, is that you? Good morning.
Good morning, Scott. How are you?
I'm well, thank you. We've been talking with Dr. Philpott just briefly about the lower case numbers at the hospital, which we're very glad to see. But she was just telling us that we haven't seen, at least so far as we can tell from the Department of State, any Omicron variant cases in San Juan County. I'm going to pass things over to Megan, who I know is just waiting patiently for me to stop talking so she can ask a question.
Yeah, no,
for the first time in a month.
That's right. Yeah, hey guys. No, my question is related to the statement about this variant being a milder form, and I think that's kind of led to some lackadaisical feelings around and behaviors around what's going on. And so I'd like you guys just to speak to what that means. I mean, is it true that this is milder? What does that mean for our behavior, our community? So maybe Dr. Greenberg, since you just jumped on, you can take that first.
Sure, happy to. There is a bit of a mixed bag of information, and I do think it's important to kind of unpack this. Now, right now, though, we are seeing unprecedented increases and really record case numbers across the country, like increases by 204% in the last 14 days. This is by far the fastest spreading COVID-19 variant thus far. Across the country, we're seeing well over 500,000 cases per day. And we're seeing, challenges with testing supplies, supply chain disruption, travel-related issues, work and school-related disruptions. And this is very concerning. I mean, hospitalizations have actually shown an increase in 35% in the last 14 days across the country. But there is a silver lining, like you alluded to, Megan. But there's some nuance to it. And the risks for ED visits, hospitalizations, ICU admissions, and mechanical ventilation were consistently less than half among Omicron infections when compared with Delta infections. So on a person-by-person basis, it seems like, the risk of serious or the risk of severe COVID is less. And it also looks like the case incidence, so the unprecedented, amazing number of cases and hospitalizations, those two numbers look to have basically decoupled. So on a person-by-person basis, less people are sick. However, the sheer vast number of the simultaneously ill, 500,000 cases a day, means that hospital systems and hospitals like ours are still having considerable challenges. And this still represents a really serious threat to healthcare infrastructure. So even though on a case-by-case basis, it looks like things are a little bit better when compared with previous variants, the aggregate means that there's a really huge demand for healthcare services. Now, we don't know quite what's going to happen from a mortality and morbidity perspective, but we know that the inpatient demand continues to be fueled by the unvaccinated. So please, please, please get vaccinated. And the Omicron variant across our whole country and in communities is still a very big deal. Let's take this silver lining and not let it subvert our need to get vaccinated and practice COVID-safe practices.
Very helpful. Thank you. And Dr. Philpott, do you have anything to add?
Yeah, I think just another couple aspects of our current situation that play into sort of what we may see with the Omicron variant. We're seeing across the country, as Dr. Greenberg alluded to, a large number of workers being infected in whatever industry that may be. And of course, in healthcare, we're very concerned about that possibility. So people not necessarily getting extremely sick, but our vaccinated healthcare workers, we are seeing more breakthrough infections. The vaccines are so protecting against severe disease and hospitalization. Those breakthrough infections among vaccinated individuals are, of course, required to self-isolate. So we're already hearing stories from other hospitals in the Intermountain West that are having to close beds and are extremely strained due to the lack of available staff. So we're having just kind of, these drops of other things in to make it even more challenging. I think additionally, these other tools we've had, like the monoclonal antibodies, which were fairly effective at preventing severe illness and hospitalization through the Delta surge, we're whittled down to only a single monoclonal antibody that is active against Omicron, so Travimab. So the Eli Lilly and the Regeneron products that a lot of people received during our last surge are no longer available. So it's just kind of the mass demand for all these different things with so many cases can really impact all these different elements.
Thank you very much, Dr. Philpott. And I wanted to ask you both, too, and Dr. Greenberg, I'll start with you, about long COVID. We haven't talked too much about that recently, and with this Omicron variant that may have less of an impact, though, we're still hearing from folks who've maybe had COVID and are feeling okay, but they still have some of these long COVID symptoms and other, damage to their lungs or hearts or things along that line from the infection, from the virus. And Dr. Greenberg, is that still something that that you and your colleagues are having to deal with and patients are having to deal with? And does it affect unvaccinated folks worse than the vaccinated population?
Long COVID is absolutely an ongoing concern. And we really do, it looks like vaccination both helps mitigate the likelihood of infection and therefore long COVID, and also becoming vaccinated after your infection appears to mitigate some of the symptoms of long COVID. The numbers that we had been using for some time are that 30% of people that develop a COVID infection, even if the COVID infection itself is relatively mild, can develop long COVID. And that is a constellation of fatigue, cough, intermittent chest tightness, occasional shortness of breath, body aches, and sometimes some difficulty to focus, like some cognitive challenges, have been reported in long COVID. And it remains something where there are now clinics that are being stood up across the country to look at the impacts and the multidisciplinary approach to long COVID. But this is something where the best treatment for long COVID is to not get it in the first place. So we remain very concerned about it. And medicine, I would say medicine in general, is doing its best to try to respond to this and to build an approach that helps relieve pain and suffering.
Thank you very much, Dr. Greenberg. Dr. Philpott, do you have anything to add to that with patients suffering from these long COVID impacts to their health?
Yeah, I think the only thing I would say is, and we talked about this just yesterday at the hospital, each of these variants has such distinctive features that I think that demonstrates there's different physiologic impacts on the body. Early on, like for example, Omicron doesn't look like it's impacting our sense of smell. And losing the sense of smell demonstrated this neurotropism, meaning the virus probably went up, more into the brain or affected the nervous system. So after the Delta surge, which has by far and away been our worst yet as far as mortality and sort of challenges there, I think it's really early to say how we're all going to be impacted, or how society and all the people who were infected with COVID are going to be impacted on a long-term basis. So I think there's going to be just constant emerging data, and it's going to be so variable and difficult to sort through because everyone, we obviously don't know which variants we have had if we get COVID. But I think we'll get more information as time goes on.
Very helpful. And now I guess our last question before we go, and nobody has a crystal ball, but should we be bracing ourselves for the next surge given this new variant? Dr. Philpott, why don't you take that first?
Yes, I think, your first question, people are looking out through rose-colored glasses. This is mild illness, and have just sort of succumbed to the idea that we're likely all going to get Omicron, vaccinated or unvaccinated. Of course, those unvaccinated with the potential for much more severe disease. But I unfortunately think we need to be bracing ourselves for it. And I think we need to really heighten our rigor. The previous public health measures, or, how we've acted in the grocery store, are unlikely to be effective compared to, of course, depending what you did, but compared to past variants. It's just highly infectious. So not wearing a mask, even if you're vaccinated, is no longer appropriate for Omicron. And I would just encourage the community to please help us. We are going to have a really rough, probably month, 4 to 8 weeks coming up, depending what unfolds here, just based on the case trajectories being so steep.
And Dr. Greenberg, before we go, do you have anything to add to that?
One of the things that's been a hallmark of this pandemic is that how we do as a community really, it truly is the sum of our own individual choices. And as Dr. Philpott was saying, this time, for these coming weeks, the ask for each and every one, anyone who's listening and anyone who can talk to anyone else and their friends, family, and community, is that let's buckle down. Let's get this case rate per 100,000. In La Plata County, for example, just to the north, it's 934 per 100,000. That is an incredible number. It's really high. Let's all buckle down. Let's do hand washing. Let's mask appropriately. Let's really be careful. For these coming weeks, this is a wave. It's not going to be forever, but this is a wave, and now is the time when we need to pay some attention to it. Because I agree, I think that we are bracing ourselves, especially at the hospital, bracing ourselves for an increase in demand in a number of settings. And we look to each and every member of our community to do their part to make the right kinds of choices to help buffer that so we can be here for you in any time of illness and injury.
Dr. Brett Greenberg and Dr. Erin Philpott, we always appreciate your time with us on the program. Thank you both for joining us